Guys, welcome back to Medical Coding with Blue. Today's episode is all about, are you taking a medical coding certification exam? Do not self-sabotage. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got this comment from a viewer that was talking about having extreme test anxiety. I'm going to read the comment here in a minute, but I want to say this. What you put out into your universe, into your energy, right? What you put out, as far as the things that you say, it is going to have a direct impact on how you feel and how you perform. So if you are constantly telling yourself that you are an extremely nervous test taker, if you are so preoccupied with failing a test or failing at life or failing at this, failing at relationships, whatever the case may be, that is exactly what you are going to do. Because this is you telling yourself this. This negative self-talk is what prevents a lot of people from reaching their maximum potential, because they're so busy and preoccupied with how they've conditioned themselves. And it may be that they are in an environment where they don't have that much support. And that could be it. That could be an external factor influencing them and how they're looking at themselves. But everybody has the ability to change their situation. Everybody has that choice to say, you know what, I'm not gonna stand for this. I am not gonna stand for that. I always get nervous every time I take a test. I'm gonna make sure that I get prepared, because a lot of that, for a lot of you, is what the problem is. Lack of preparedness. It has nothing to do with physically being so anxious that you can't perform. A lot of it has to do with the fact that you did not prepare. Prepare properly. And what I mean by prepare properly is, I've always said on my channel that you have to study 20 hours per week. 20 hours per week. 20 hours per week. That is your secret sauce. That is the magic number that is going to help you to get prepared. It is possible. Before you give me this load of garbage that says, oh no, Blue, I work a 40-hour per week job and I have a whole family, kids, and everybody else to take care of. Okay, but I'm sure that you have 30 minutes here, or you have an hour break there. You have time, and that you spend a little bit of time each day, and you total up 3.5 hours in a day. That adds up in 5 days. That adds up to 17.5 hours. And then you have 2.5 hours on a Saturday or Sunday. You're not studying for more than 1 hour at a time. So it's not going to impact you being able to take care of your family, or you being able to work. You have 2 15-minute breaks at work, don't you? You work an 8-hour shift. Don't you have 2 15-minute breaks? Don't you know that you could pull out flashcards at that time and be studying or listening to videos about anatomy and medical terminology? There's even HIPAA videos on YouTube. So see, there's plenty of things that you could be doing instead of making excuses about why you keep failing a test. So I'm going to read this message that inspired today's episode, but I will say this also. Anything is possible. Anything that you want to do at any age is possible. I know that because of the industry that I'm in health information. I see people from all ages and stages of life. My very first job, I worked with a lady who was age 61. And she's still a coder today. And I have been a coder for 16 years. This year will be 17 years. She's still coding today. So let me read this. So the viewer says, thank you, Blue. I appreciate your pep talk. I've been trying to get certified for the CPC since 2023. I'm not good at taking tests. I have extreme test anxiety, but I'm going to keep trying. And I have to invest in more books in 2025. I'm glad you explain all of these coding credentials are not necessary. In college, our professor stressed every day to the class to pursue the CCS. I don't know anything about the CCS. We were there for the CPC, medical coding and billing. I must also mention, Blue, I'm in my 60s. trying to learn the concept of coding. I've also, I've bought many books to learn this career. And you're absolutely right about office jobs. I'm a scheduling coordinator going on 3 years and can't get out. I apply for coding jobs anyway. I'm so stressed trying my best. Thank you for the video. Okay, so guys, I know some of you are going to say, Bleu, you didn't have to say it like that. Well, here's the thing. First of all, when they say, I have extreme test anxiety, this is the thing. Lack of preparedness. Lack of preparedness. Not studying sufficiently. Doing all those things like you're supposed to. Making sure that you get proper rest. That all impacts your ability to perform on an exam. There is no reason that if you have been diligently studying since 2023 that you should not have already passed that exam. No reason at all. And it doesn't matter your age. It does not matter your age. You can do anything at any age that you want to. It's up to you. It's up to you to speak those positive words into existence, not always thinking about, oh, I don't do well on this. I don't do well on that. I am not a good test taker. I am not this. I am not that. Well, what are you good at? You have to be good at something. And it's not the things that you don't want to do. Like, oh, well, I've done patient scheduling for 3 years and I can't get out. You absolutely can get out. You absolutely can get out. If there's a will, oh, there is a way. If there is a will, there is a way. But sometimes we get so complacent in these positions that we get that it feels like it's impossible to get out. There are many alternative jobs to getting into medical coding that I've talked about several times on other videos. And again, if you're not doing your research, which I will point out that this lady said, oh, well, that the college professor said to pursue the CCS, and she doesn't know anything about the CCS. They were there for the CPC. So why didn't you Google it? Ma'am, why did you not Google it? Why did you not look up what it is? Because I'm sure that if the college professor was encouraging you all to take the CCS, they were probably explaining what it is as well. The CCS is the gold standard of medical coding credentials. It says that you have mastered inpatient coding and outpatient coding. And there's other benefits to having this credential as well. It is one of the most sought after, highly in demand medical coding certifications because this says you can go anywhere. And the more experience you get with a variety of things that you do in this career, the more opportunities you will have. But some of you are very closed-minded. Let's be honest with that. You are very closed-minded. You only want to do certain things. I only want to start where it's easy. If you only start where it's easy and you're spoon-fed all of those things, there's a good chance that you're never going to build that skill that coders build in those first 2 years. The first 2 years of any coder's career is very critical. If you are not surrounded by a good group of people, mentors that you can look up to, and trying new things while it's all new, you will struggle your entire career because of the simple fact that you are so used to only certain things. If you get into a repetitive clinic, your first job, let's just say you went into you went into HCC coding, risk adjustment coding, right? You went into risk adjustment coding that I tell y'all, don't stay too long. You can get experience there and move on. Risk adjustment coding is only diagnosis coding. And for those of you who get real excited and say, oh, well, that's good. I want to do that because I only got really good with the diagnosis part. I didn't get really good with CPT. No, absolutely not. That is meant to be a very short stay, 3 months or 6 months. If you look at some of the job listings, they will actually say that if your only experience has been in risk adjustment coding, that they don't count that as experience because it's just diagnosis coding. That means you have lost your ability to be able to do procedure coding, whether it's inpatient coding or outpatient coding. Okay? There was a time that you didn't even need to be certified to be a risk adjustment coder. But because they created a credential that says risk adjustment coder, now it's suddenly very popular to have it. And for what? Are you getting paid extra for having it? No. You are getting paid the same as somebody who has the CCS, CCA, CCSP, or CPC. The exact same. They say, oh, CRC is preferred. Well, CRC is preferred. Preferred does not mean required. It just means that you've taken another test and that you have to put out more CEUs. Is that employer going to compensate you for those extra CEUs? Likely not. Likely not. Because again, you are starting off brand new. This is why I always tell people, when you're brand new, don't have more than one credential in the first 2 years. You only need one credential, okay? And the lack of this person not doing their research, not looking up what the CCS is ridiculous. There's just no excuse for it. If the professor is telling you something, it's for a reason, because they know that that's in demand. They know that that's going to give you the most opportunity to get out there to be able to find a job in coding, okay? They know because they've been there. And yeah, there's some bad professors, but this one, this one was encouraging them and hoping that they would hear the message. But again, this person is very close-minded, like, okay, no, I only want to get the CPC because that's what I'm there for. But you can look up what the CCS is. So like I've said in all of these videos that I've done before about being nervous and stuff like that, when you're taking your test, if you are sufficiently putting in the time to study and get to pass this test, whichever test you're taking, the CCS, CCA, CCSP, or the CPC, any one of these four, if you are taking the time properly, 20 hours per week, 20 hours per week, you are going to feel more confident walking into that test room or sitting in front of that computer to take that test. You're going to be more confident. If when you are looking up codes, you are covering up multiple choice and you are trying to look them up on your own, you will be faster when you are sitting in that room trying to look up the codes and trying to hurry up and get these questions answered. You will be much more faster than the person who's only being taught or who only wants to learn process of elimination, the little shortcuts, the multiple choice. They're going to be looking at the multiple choice every single time. And when they're practicing, and then all of a sudden they start to remember the answers because they're remembering this book and they're remembering from the answers. Okay, well, then they get that false sense of confidence because they think that they know it. And all they're doing is just guessing their way. And then when they get into the test, then they don't know what happened because, oh, I studied. No, you didn't. All you did was practice looking up multiple choices. You didn't try to learn foundational coding. Well, Bleu, I don't have time for that. I don't have time for that. You do. You better make time. Because if you don't, the result is going to be another failed test. And then you're going to sit here and you're going to wonder why. You're going to wonder why did you fail? Why did you fail? You're going to be one of those people on LinkedIn going on about how, oh, they failed and they don't understand why they failed. That one lady that I had to block, she says, oh, I've always been a failure. And you're going to continue to be a failure with that attitude. You will. Nobody has to fail. Nobody has to. You have to put in the time if you want a different result. If you don't understand something, make a post on LinkedIn where you're saying, I don't understand this concept. What I understand of it is this, and the third, right? And so then you'll have a lot of people that will come on there to help you to answer your question. Trust me. Oh, trust and believe. There's plenty of people out there that are willing to help. But what they're not willing to do or not willing to pay attention to is when people start complaining. Because I know the second I see somebody start complaining, I block them on LinkedIn. You get blocked. I don't have time. I don't have time. I don't want to see it on my feed either. I don't want to see it at all. And a lot of times these people are asking for advice. They're like, well, I don't know what to do. I've been looking for jobs. Did you not see that I'm a YouTuber when you friended me? Did you not understand what I do as a content creator here on YouTube? That there's tons of resources that maybe you haven't even tried. And then those people that are putting up their resume that's 4 or 5 pages and saying, I still don't understand what's wrong with this. You know, you can Google medical coding with Bleu resume tips, and my video for resume tips will pop right up. You don't even have to go through YouTube to look for it. You don't even have to go through my channel and all my videos to find it. You don't. You can go right to Google and it'll bring it right up for you. So really, there's no excuse. There's no excuse for the negative self-talk, for thinking that you can't do something when it's absolutely possible, even without a medical background. I had no medical background when I first started. None. And I still managed to pass my CCA on the first try. Now, a lot of people would say, oh, well, why didn't you get the CPC instead? No. Why? I got the CCA. CCA says I know inpatient coding and outpatient coding. I can go anywhere. I can go anywhere. And I held on to the CCA for 13 years. And I'd still have it today if AHIMA would let me, but they won't. You know, because I'm just trying to prove a point with the CCA. You know, there's a lot of ignorant people out there that don't know about the CCA and they talk trash about it. Probably could never pass it themselves. I'm just saying. So with that said, the thing that you have to understand is this. If you are studying like you should, the 20 hours per week, you will go in there with a more confident sense of being able to pass this test. When you are studying, if you are covering up the multiple choice answers, if you are working through the book, if you are learning from start to finish, like looking up codes in the index and then going back to the tabular when you're practicing and doing all of those things, getting into that comfortableness of the book, looking through your book so that you can identify where the appendixes are, where those things are that will help you. You could take your books in there with you. It is an open book test. Okay? It doesn't need all the tabs, the stupid, silly tabs. It doesn't need all the writing, the highlighting, the underlining, the circling, which is so stupid. I have seen a lot of stupid things being a medical coder. But the circling, really? The circling? You could dislike the video. I don't care. I don't care. This is the thing. If you are circling because you can't see a simple indentation, what's wrong with this picture? What's wrong with this picture? I had somebody that I of course said it on the show. Don't do that. Don't circle. Don't do that. Then she writes me and says, "Oh, Bleu, I got a tutor, and she said that I should be circling the codes, the parent and the child codes, so that way it'll help me." Oh, what do you think? I blocked her because I already gave my opinion on what I thought about that and the fact that you shouldn't do that, and that's adding training wheels where you don't need them as coders, right? You don't need those training wheels. You need to use the book as it is intended. Doctors and scholars write these books. They write these books in a way that is used for reference. That's what it's used for. And even though there's people out there that say, well, Bleu, what about the encoder and all these other things? With the encoder, you have to learn to put the words into the decision tree so that it gets you to the correct code. If you don't know the answers to the questions as it's going through the decision tree, it will lead you to the wrong code. Ask me how I know. Because when I started using an encoder, that's what happened. I was like, oh my gosh, this is not even the right code. It's not even the right series. But when I backed up, I saw where my mistake was. But that's me having years of experience, or having experience at the time. It wasn't years at the time, but it was experience at the time when I first started using an encoder. Because my first job, I didn't use an encoder. Second job, I did. And it had been a few months. But it's still possible to select the wrong choice and end up with a wrong code. But thankfully, because I can recognize, hey, this isn't the series I'm supposed to be in, I can always go back and look at that again. But you get good with that by having a good solid foundation too, with looking things up in the book. If you want to neglect books, if you say, oh, I don't like books, this field is going to be very difficult for you, because that's what we use Those are our tools. And having good tools is what will help you. You know, a lot of people say, well, I have this certain other type of book, this other publisher of book. I don't like that other publisher of book. I won't even say, because it's ridiculous. It doesn't help you. It doesn't help you. There's not all the helps in there like the Optum books. And if you look on the AHIMA website or the AAPC website, it says that you can have your choice of your ICD-10 CM book, your ICD-10 PCS book, and your HCPCS book. You have your choice of publisher. So you can use Optum books. Optum books are freaking fantastic. And as I've said, if you are looking at the ICD-10 CM book for Optum, the Expert for Physicians, I don't care about the hospital version. I use Expert for Physicians. That's what I use. Don't ask me what the difference is, okay? That's the one that I recommend. And when you, and that's the one that's acceptable for the exams too. And when you look at the beginning of every chapter in the tabular section, there's a copy of that chapter specific guidelines, and then it has examples throughout that chapter of the guidelines, and it has the answers. It's got the rationale as to how they got to those answers. So you could be using your own coding book to practice with. It's like a workbook all in one, because there's like 20 or 30, sometimes 30 different examples. It really all depends, because every chapter is going to be different amount, but it's a lot. And you can cover up those answers. You can look up what the question is asking so that you can get practice in every single chapter. You do that, you want to talk about how much more confident you're going to be when you're walking into that room, because you know how to look up codes. You know how to do those things. That's how much more confident you will be. It's the same for the person that has been consistently reading the coding guidelines. It is the same thing, because people start to panic because they don't know the coding guidelines. And a lot of these simple questions that I see, it's a guidelines thing. It's a guidelines question. They talk about sequencing. They talk about mother-baby. They talk about injuries. They talk about all these things. And these are all things that could be answered simply by looking in the guidelines, reading the coding guidelines. But with that said, these tests and these results of these tests is what you're going to make of it. So if you're being negative and you're saying negatively, oh, I always fail tests, or I have this extreme anxiety, that's the result you're going to continue to get. Instead of changing it of, I'm going to pass this test. Start putting your name, comma, and your credential that you want, and put it in a place, write it down on a piece of paper, put it in a place where you can see it. Put it in a place where you can see it. So that way it can become a part of your reality. And then you sit there for those 30 minutes. You sit there for that 1 hour and you work through your book. You read those coding guidelines. You listen to them if you can find the instructions, right? You do that. You get that practice in. You watch videos on YouTube about anatomy and medical terminology. Go to Crash Course. Crash Course is a wonderful channel here on YouTube that talks all about anatomy and medical terminology and pathophysiology, all the things that you need to be strong in to be a very good coder. Listen to those things so that way you can get that ambient learning. You can be doing something else and be listening and learning. That's a part of studying too. That's a part of studying too. And this one lady asked me, oh, when you say study, do you only mean when I'm working with the book? And literally in the video, I said, studying constitutes you're watching the videos, you're going through your book, you are working through a workbook. That all constitutes as studying. So let me say that again. All of that constitutes as studying. Anything that's getting you prepared. Do not be trying to cram. Do not go for long stretches or hours at a time. Somebody told me, Bleu, I studied for 8 hours and now I have a headache. You earned that headache. No one told you to study for 8 hours straight. That's ridiculous. You do your 30 minutes, you do 1 hour, and you take a break. Let your brain marinate with all that new knowledge that you're coming in with. That way it can stick. At least that's just my advice anyway. So with that said, stop blaming the fact that you have, oh, I've always been had texting. No, you can turn that around at any time, whenever you're ready. And you do that, okay? Oh, it's my age. It has nothing to do with your age. Nothing at all to do with your age. Absolutely not. If you have that will in you, you will do it. Whatever your circumstance is. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.